Good afternoon, everyone. I am absolutely thrilled to be back at the Autoimmune Community Summit for a second year in a row. And this afternoon, we're going to be talking about navigating your career plus autoimmunity. In today's session, you're going to hear from a recruiter, excuse me, you're going to hear from a recruiter that specializes in connecting the disability community with meaningful employers and tips from an autoimmune patient thriving in the workforce. My name is Anna Ellis, and I was diagnosed with systemic juvenile idiopathic arthritis at age 11, which unfortunately for me has persisted well into adulthood. And as a result, all of my lived experience accessing both education and building my career has been through the lens of also managing my chronic illnesses. It took me more than 10 years to finish my bachelor's degree in business, during which time I had 3 different hip replacements. And while today I'm the Associate Director of Patient Affairs and Advocacy for a small clinical stage biotech company here in Boston, I've previously had experiences that haven't been as empowering in the workforce, which have included disclosing my illness only to see a promotion that I was working to magically disappear, as well as being restructured out of an organization just weeks after having my second joint surgery in 4 months, despite previously having glowing performance reviews up until then. So, for me, like many of you, I'm sure this is a really fraught topic that I'm really excited to dive right into. And with that, I'd like to introduce the rest of our panel. Wonderful. Anessa, I'm going to start with you with a brief introduction, please.
Well, thank you so much. Delighted to be here. My name is Anessa Powell. I'm founder and CEO of All Ability Recruiting. We specialize in connecting the disability community with meaningful employers. We do that through employment, and now we've recently added consulting, where we work with clients to help them be more inclusive with the disability community within their company. And I have the lovely opportunity to say that I am an autoimmune patient. I was diagnosed in 2013 with Addison's disease, but before that, I actually was diagnosed with Hashimoto's. So I have a couple of lovely ones in my bag of fun stuff. So it's delighted to be here. Love talking about how I manage my condition and working full time. So thank you.
Awesome. Thank you. Anessa, Liv, you're up next, please.
Hi, everyone. It's so wonderful to be here, and thank you so much for introducing us. My name is Liv Liu, and I'm owner and founder of Move to Live. I'm a certified personal trainer with the National Academy of Sports Medicine, and I specialize in very dynamic and adaptable movement for the chronically badass. So my journey started when I was 4 years old. I was diagnosed with idiopathic juvenile rheumatoid arthritis, and it has been a big part of my life ever since. And I was also diagnosed with uveitis at age 8. And so it's been a big driving factor and a superpower of mine that I apply to my work when I create safe spaces for the community to move and thrive in.
Thank you, Liv. And last but not least, Hillary, if you don't mind introducing yourself, please.
Hi, everyone. I'm Hillary Wool. I'm based out of Philadelphia, and I work as a principal at Boston Consulting Group. I'm a management consultant, and I focus on healthcare and public sector. So thinking about public sector health systems and how we can help them modernize and make them better serve patients and serve the population. So I acquired my diagnoses, disability at 30 years old. So when I was well into my career, after graduating from business school, after getting into even my second career, I have ankylosing spondylitis, which is an autoimmune disease that attacks the spine, SI joints, hips, as well as Ehlers-Danlos syndrome and dysautonomia, which are also a connective tissue disorder and kind of neurological autonomic nervous system condition. And my disability has become more visible over the past 4 years. So I use like crutches and a wheelchair a lot most of the time when I'm out of my house. And so I think just experiencing all of this while rising through my own career as well as leading our company's disability staff network has just shaped a lot of perspectives on some of these topics that I'm pumped to share with you all.
Thank you so much, Hillary. Thank you all for sharing. First topic I want to dive into today is this idea of how we disclose in the workplace and also knowing your rights. As part of my introduction, I, alluded to having a really negative experience with disclosing to one of my employers. But during our prep call, something that you had said, Hillary, really resonated with me. And it was the idea of disclosure being a two-way street. Could you talk about that today and what you meant by that and what your experience has been?
Yeah, absolutely. And I think a lot of this perspective comes from not only, again, my experience at first being pretty junior in my organization when I acquired my disability and having to get through the discomfort around, how do I have a conversation about this with my manager or with HR? And now in my leadership role for our disability network, as well as a manager of teams, just seeing what the risks can be, honestly, of not disclosing. And per the two-way street thing, I think it's really, really important that not only can we get, members of our community to a place in their organizations where they feel comfortable enough disclosing, but providing education, destigmatization, and resources for managers and teams, as the burden should absolutely not just be on folks with chronic illnesses and disabilities. It needs to be a shared responsibility and shared allyship. As you alluded to, reasonable accommodations for large organizations are protected by the ADA, the Americans with Disabilities Act, and recognizing that while every company has a different level of maturity around, their HR processes, their DE&I, processes and networks and culture, I think in an ideal world, in every organization, employees should be empowered to speak up, to disclose to both HR as well as your line manager, your teams, and managers, even if they might not be familiar with reasonable accommodations or, they might not have a disability themselves, need to have the resources to be able to navigate that conversation bi-directionally. So I think in my experience, I've seen that, when staff members come to the table, to have an open conversation, to be honest, and to really frame things in terms of like, how does this impact the work, right? How can we optimize the work setting to make this work for them, but also like for the manager to just do what's best for the team? That can be positive. I also think psychologically, like disability is part of my identity. And so it's important for many people to just be in a place where they can talk about all parts of their identities. And so recognize some organizations, as you alluded to, Anna, have a long way to go on this, but that is certainly the ideal.
I love it.
You're here.
Oh gosh, Hillary, I came up in consulting and I only wish that I knew you back then because things would have gone a lot differently for me, I'd like to think. But, something that I want to acknowledge is that for all of us on this panel, we have more or less leveraged and harnessed our career, harnessed our diagnoses as sort of a superpower, which we'll get to later on, but they've really informed our careers to date. And so I want to be really sensitive to the fact that this is probably not the case for most folks on this call. And there are a lot of people that are in attendance today that are working completely outside of the scope of healthcare or sort of a relevant or tangential career. And how do you disclose in those environments? And so, Anessa, I'm going to kick to you. I know we could talk about this for 2 hours, but if you had a few of your top tips about how to disclose or even resources that you would want to point people in the direction of as far as disclosure goes.
Yeah, absolutely. I could talk about this for hours because this is what I do every day. But, in this day and time, I think we've learned so much through this pandemic that we have learned who we are and how we want to be valued and treated, because we know that we don't know what's coming around the corner, right? And we don't know what that means with our health. The fun thing about autoimmune is that we usually just doesn't stick with just one. We continue to grow. So as you are in a work environment and you feel like your particular health is changing, you have to be mindful of that when it comes to your working and with your disclosure and what you share within your community and your work community and your teams. And the only way that you can do that is with your honest self. And don't you want to bring your whole self to work? Don't you want them to see you who you are? And for me, who I am, a part of it is I just happen to have multiple autoimmune diseases, and that does affect my day-to-day life. And I have to be very mindful of that and how I plan out my schedule. We can talk about that in a minute. But, I think, yes, there is a raw vulnerability when you do disclose, right? You feeling like, okay, I'm going to be sharing something that's very personal to me. How is this reaction going to go? And it can go various ways. I think, though, that in order for you to get the accommodations that you need and for you to get the place in which you feel comfortable at work and you feel like you're being valued, it's with honesty. And does it always go, as Anna mentioned earlier, in great situations? Does it always go the way you want? No, but it also tells you the work environment. Is that something that you want to be a part of if you know that you're automatically being looked at differently because you have shared this, right? You have to be very mindful of the environment that you are in, and being a part of that is the honesty and sharing. I would say we always encourage our candidates to share, because in order to get those accommodations met, it needs to start from the very beginning, having those conversations. And when we tell our clients and our companies this, when you do receive these, let me assure you, the percentage of accommodations do not cost what you think. It's over 90% of accommodations cost less than $500, truly. That's not breaking the bank for companies. So it's a two-way street, as Hillary mentioned. It very much is, but it goes back to communication and wanting to, in this day and time with companies really focused on their diversity, equity, inclusion. You can only do that if you are showing who you truly are and being honest and present.
Thank you. No, I think your point about the pandemic is really salient, not just because of all of the really difficult things that we've all had to live through as autoimmune patients these past 2 years, but work, at least for many of us, is more flexible than it ever has been. And I know for me, my health has strangely improved tremendously over the past 2 years, just by nature of being able to ditch my commute and be at home as much as possible. And I think being able to harness some of the flexibility that's finally being extended to everyone and not just folks that are in need of accommodation we would all be remiss if we didn't take advantage of that to the best of our ability right now. Liv, you work in a little bit of a different space than the rest of us. And I'm, as somebody who's also really passionate about working out, I am very lucky to also have found a very inclusive wellness space for myself. But I'm curious to know if, when you disclose both to other colleagues in the wellness industry or even to some of your clients who maybe didn't read about exactly who you are, have you ever faced stigma in the wellness industry when you disclose your chronic illness and your diagnoses? And what does that look like? And how do you navigate that in such a unique space that's different than what the rest of us are doing?
Oh my goodness. That is a wonderful, wonderful question. And like 15 memories just flashed in front of me.
You can have one.
So when I first started, so to answer your question about a stigma, when I actually first started, I was under a mentor who I really looked up to. And as I was in training to like lead this movement class, I sat down and I related to one of the attendees, and I talked about my own pain and how I relate to it and how to grow from there. And the feedback I got from my mentor was, don't ever show your pain. And then that was when I knew that I had a superpower and that was not okay. I moved forward from that mentor, of course, and moved on into like a much more positive space. But besides that experience and being in classes where like I would have to stop and slow down and people didn't know why, because our conditions are often invisible, they're not seen. And so I'd be in pain and this person is pushing and pushing. But when I do disclose and talk about my experience and my journey with clients and other people in the wellness industry, they are I've had such beautiful feedback, which tells me that the world is shifting, right? And you know, it's enabled me to relate to them on a whole nother level. It enables me to create this like very empathic space where we can talk about and give ourselves permission to be exactly who we are in any space, and work through that and meet ourselves where we're at. So I fortunately have had a very positive experience. I'm also very passionate about just speaking, like you said, like speaking your truth and speaking it confidently, because there have been times in my old a career I had before this that I held back. And that strength didn't come through because I wasn't speaking my truth. And so the moment I started really just owning all of me and like exuding not only like where I do feel weak, but also where I feel really strong, and how that all connects so beautifully, I've had much more positive experiences because of it.
That's so, oh gosh, I'm so sorry you went through that with your old mentor, but I'm not surprised, but also thrilled that you found a space that's safe for you, where you feel really empowered. Now, I said before that I was going to keep us honest on time. We have 9 minutes left in this session, guys. So we're going to cover one more big topic. And it is, you know, what Liv, you've alluded to, is this idea of using your autoimmune disease as a superpower. Now, I have to be honest, this forced me a little bit out of my comfort zone as far as the language we were using, but something that I realized as a professional, as a manager and a leader, it is impossible not to be the most empathetic human on earth by nature of everything that I've gone through personally and professionally. And the way that I do this in a really practical way in my role right now is that when I'm hiring, I am always looking for non-traditional candidates. I'm looking for folks who maybe took 10 years to finish their degree, who maybe don't have a degree that's relevant to what we're hiring for. Working in industry, I'm looking for folks that didn't come from industry. I'm looking for underrepresented individuals and identities when I'm hiring. And when I feel like when I am able to bring those folks in to the extent that I'm able, I drop my mask, show up as my full authentic self. And for my teams, always want to create that same space. And it requires me to sometimes be the squeaky wheel and go out on a limb and be really, really vulnerable with my colleagues, which even working in biotech where I am right now can often be really challenging. So having been vulnerable-ish with everybody, I'd love to hear from the rest of you how you guys harness your diagnoses and your experiences as your superpower and what that looks like in your day-to-day. And now I've talked us down to 7 minutes. I'm sorry. Hillary, I'm going to start with you again, if you don't mind going ahead.
I'll be quick.
Okay.
Building off of the piece about being a manager, I think one thing I've realized with my managers and then also with the folks that I develop and lead is when you are open about whatever is going on for you, right? And for me, it's disability, a mixed racial identity, gender. It really does give permission to others that you're leading that they can be open as well. And I found that with certainly with my team leaders too. And then working as a healthcare consultant, so like my job is to help solve some of the toughest challenges that are facing healthcare organizations. Some of that relating to patient experience and patient operations. And so whether it's, it was a specialty pharmacy project that I did about reducing the time it takes to fill a prescription for, a rare disease, or other kind of human research focused on improving patient experience. I think just bringing some of my firsthand knowledge to really pressure test what we were doing, was helpful for the role. So just a couple of examples.
That's awesome. Oh, I love hearing that. And I'm sure specialty pharmacy made everybody perk up right away. Mm-hmm. And that's what are some of the, like, if you were to give advice to, to somebody that you were trying to help place into a role, talking about harnessing this, again, I'm going to ask you as a professional, since this is what you do all day, every day, what's some of the guidance or advice that you would give to folks that are looking to really position their experience as a patient as expertise or as good job experience?
Well, I think the beauty of being diagnosed truly and understanding we are so in tune with our bodies more so than I think that most people are on a day-to-day basis, and use that power for good, honestly, because you can lead by example. I will tell you, this company would not exist if I didn't have my diagnosis. I have a degree in hotel restaurant management. I mean, hello, totally random. So here we are now. It completely changed the trajectory of my life. It really did. And so now I can speak for patients and our candidates that have gaps in their resumes because they were sick, because they were injured, because they were in the hospital, because of all of that. And I just still see the value in them. So when you are looking at yourself and you can lead by example, and that's one thing that we really push within our company, is that where are the executives talking about their disability? Where are they showing that? Well, you know what? Take a look at yourself, because you lead by example and you go in there and say, look, these are my limitations. I can't work before 10 in the morning, but you know what? 2:00, I am going to knock it out of the park for you. And I'm going to show you I can get my job done if you allow me that leeway to do that. So there's so many opportunities just to lead the way and show that who you are. But first you have to learn yourself and what your superpowers are, and then just run with it.
Oh my gosh, that's such a great tangible example. I love that so much. Liv, I'm wrapping up with you on this, and it's not an accident, because you were the one who really introduced this concept during our prep call, this idea of using your diagnoses, your illness, your disability, however you identify, as your superpower. We have a few minutes left. I'd love for you to speak to why you raised that on our prep call and what it means to you and what it means to the broader community.
Absolutely. I mean, it's really simple, really, because it's just putting yourself in somebody else's shoes. But we've actually been in those shoes. We've worn very, very similar shoes to these people who are coming in. And I think even for folks who are without a diagnosis, it's all about using these superpowers and these empathic abilities to read nonverbal cues. I mean, I've been in a session with somebody, and we've all done this, like, how are you doing? I'm fine. So tell me more. It's just that ability to dig a little deeper and make that difference in every session, in every room you're in, whether, no matter what arena you're in, both professional and personal. And so it's just like a really beautiful thing. And because of that, you're able to connect just so much more deeply, and people do feel more vulnerable with you. And the theme of vulnerability, I think, is at the core of it. And it's just really, really beautiful how we can see people and hear them a lot differently than they are used to being heard and seen. And we're just creating a lot more accessibility and a sense of safety in every space that we're in. And that's really wonderful.
That's so fantastic, Liv. Thank you. I think this concept of safety has kind of come up in a lot of different things that we've tried to allude to, right? And at the end of the day, we all deserve safety, whether it's physical, emotional, psychological. We all deserve that in our workplaces. And so I just want to thank you all for sharing so candidly, even among a community that has so much similar and shared experience. For folks on today's session, if you look in the Whova app, all of us have shared different pieces of contact information. I'm going to volunteer us all, or maybe just myself. If you have any other questions, you want to connect offline, especially about maybe some tangible pieces of advice, can't recommend looking up Anessa on LinkedIn enough. I read her posts every day and take something away from them. So thank you so much. I love this topic. Wish we had another 2 hours, but I think that the more we talk about navigating our careers and autoimmunity, the more we can normalize it both in and out of the community. You guys are amazing champions of doing so. And thank you so, so much for being here today. And we are going to end on time.
Woo! Thank you so much.
Thanks, Anna. Thanks, everybody.
Thanks, Anna.
Thanks,
Nessa. Bye, Liv.
Have a wonderful rest of the day.